Hello and welcome to Healthy Canadians Behind the Science, where we get science-specific about the health topics that matter to all of us living in Canada. I'm your host, Madeline Poplett. Today, we have Adrian Betts, Executive Director of the AIDS Committee of Durham Region, back on the podcast to talk about HIV self-test kits and the importance of knowing your status. We'll jump into that in a moment, but first, a quick word from us. Healthy Canadians is brought to you by Health Canada and the Public Health Agency of Canada. We aim to give you information and perspectives about the health topics that matter to all of us living in Canada. What we discuss won't always reflect the official positions or policies of the Government of Canada, but that's okay. These are conversations, not news releases. Okay, let's talk about HIV self-test kits. Hi, Adrian. Thank you for joining us once again on Healthy Canadians. Today we're doing the Behind the Science portion of the podcast. Before we start, I'll have you introduce yourself and what you do.
Great. Thanks for having me back. I am Adrian Betts. I'm the Executive Director of the AIDS Committee of Durham Region. That's an AIDS service organization just outside of the GTA in Eastern Ontario that does three basic things. It provides support to people living with HIV. It provides harm reduction services and support to people wanting to use injection drugs, and also then education and prevention work for people most at risk for HIV, including testing.
Okay, excellent. Well, you were the perfect person to speak to today. We want to speak a little bit more about the value of knowing your status and how testing is obviously a large part of that. It might be new information to some people in Canada that home test kits for HIV are available. How does an HIV home test kit work? What does it show the person?
So before we get into the science, can I just say that home testing is a game changer? That really and truly, when you speak about a disease that has so much stigma attached to it, HIV, it comes with other stuff that makes it difficult for people to even face testing, or there are repercussions for testing, assumptions made about drug use or sexuality or behaviors, right? And so accessing regular testing in a sexual health clinic, that's hard to walk into that space, get interviewed by a public health nurse, and tell them what you did with that guy last Tuesday night, right? And why you didn't use a condom, right? Why you think you might be at risk for HIV. Whereas a home test, like so many other home tests that have come before it, is a great way of, in the privacy of your own home, finding out for yourself if the risk you experienced actually is there actually concern, If you take a home test, you're still going to need to have them, if there's a positive result, you'll still need to get a confirmatory test, get connected to care and all that other stuff. But that privacy piece is really, really key, really a game changer. And the test is really quite simple. It's a blood drop test using a couple of different chemicals that register for the antibodies in your system. So if you drip some blood into a flat platform, and then you add the chemicals, and then it'll indicate with a visual display whether or not you're HIV positive, HIV negative, or if the test is inconclusive. And so that gives you a place to move forward from there, right? And so the test is really quite user-friendly and it's easy to use. The only time people trip up is that when they don't get enough blood for the test. And we can talk about that when we go through the process of
Yes, exactly. We can expand on some of the steps that are involved with taking the test. You've already kind of explained how it works, so a little bit about the process. It's great information, and it seems like I'm hearing it offers some peace of mind, and like I said, equips you with some information to move forward with, that you can take the proper next steps depending on what you learn from the test. So before we move on to speaking about the test itself and showing examples of portions of the test, how does someone go about obtaining a test kit?
That's getting easier and easier and easier, actually. There are several studies out there testing the efficacy of self-testing, like the Get a Kit study. And then there's also the REACH project, which is distributing HIV testing kits to AIDS service organizations across the country, all manner of places. And so you can literally go to their websites and order a test online directly from them, or you can call your local AIDS service organization in your community, and they'll either have them or be able to refer you to the people who do have them.
Excellent. So there are options for individuals looking to obtain a test. In terms of accuracy, once a test is taken, is there a better time to take a test, maybe a window? Can you speak to the accuracy of an HIV self-test?
There's certainly a window. If you, for example, you had sex last night, is that enough time for you to develop antibodies then to add them show up in the test? Most likely not. The test itself will indicate clearly what that window is.
If it's listed on the test, the individual can examine whichever tests that they have gotten their hands on, and it will let them know what the best possible window to test is. If they are testing in the ideal window, what is the approximate accuracy of an HIV test?
They're surprisingly good. There was initially some concern with the number of false positives, but there's very few false positives. What there can be is more inconclusive tests, right? And so an inconclusive test just means take the test again. It means something in the test went wrong. Either there wasn't enough blood, or there was too much of one chemical, or perhaps the test kit itself is dysfunctional. They can be affected by temperature, right? So if you, for example, it was sent for the mail and it was in a cold place or in a very hot place, it may have affected the test, but ultimately, their efficacy is quite high.
Okay, so within those parameters, it seems like this is an excellent option for somebody who is looking to get that peace of mind and learn about their status. We do have a test kit here in studio. So this is one of my first times ever seeing this. So you'll have to walk me through, but we'll open it up and take a look at this specific kit. It's an Insti rapid detection HIV self-test. So it says over 99% accurate and results in a minute. First thing we see here, instructions, what looks like the antibody test itself, and then a few vials and a Band-Aid. That's nice. There's several steps, it looks like. So we have color developer, clarifying solution, a sample diluent, and a lancet. So for the viewers who may not be watching this video, they are very small little pieces and they're color coded. Yes. So we have different colors for each piece. We also have another bag here, which I'll open, which I would assume is the actual physical test itself. Some of us may be familiar with different varieties of home test kits. So I would say sitting here opening this, it would feel as if it is approximately the same size that we're used to. Okay, so after a brief pause, I was able to get the bag open. So what we have here is a square, and as Adrian said, it is kind of in the neighborhood of between, maybe a floppy disk or a little smaller than a CD. And it has a very clear circle on the inside, which is where I'm going to assume we eventually put some of the test material in to get our results. So I'll put that here as well. So could you explain how we would operate the test? We have a lancet and a few color-coded items here.
So lay everything out on the table in front of you and get the instruction booklet and open it up. There'll be written instructions, but also graphic instructions. So it's able for anyone to follow along, whether you have a grade 6 level or lower. You can still follow the pictures and clearly see how to use the test safely and well.
Looking at these instructions, that's absolutely correct. We have visual instructions as well as, I believe there's French and English included in these instructions here. So it says the first step is to collect the blood. Could you speak to those steps, Adrian, for us?
This is going to be the trickiest thing for most people to do, right? And that's, the fear of pain, the fear of needles, the fear of blood, all those things that can cause people to go, oh, I can't do this. But this is the key part of the test. You have to make sure you have a healthy dollop of blood to go into that test, not just one tiny little drop. So what that means is when you have the lancet, you make sure your fingers are clean. So if there's not a wipe there, just wash your hands before you start. If there's a wipe, then use the wipe. But then you take the lancet, take the cap off, and then you have the needle, and you literally press that into the fingertip of your choice, right? And you want to press it into your finger or your thumb on the fleshy part at the tip of your finger or tip of your thumb, right? So you'll be able to manipulate the finger by squeezing, so you can ensure that a healthy drop of blood forms and fills the
So a small amount of blood is not what this test is intended
Well,
for.
it's not small. We don't need to open any veins here, but it is. You need to be like, it needs to be a significant drop of blood. So if it's like a tiny little pinprick of blood, that's not enough. It needs to be a big solid drop of blood. Think of it like a sweat droplet or a decent tear.
I understand. Okay, you have clarified that for me, so thank you for sure. Now we're looking at the test itself. The user has now provided an adequately sized drop of blood to the test. They're now adding this drop of blood to one of the specific steps here. So we have a dilutant, I believe it's called. I believe now this is what goes into the test itself. Is that correct?
Correct. So you'll use the dropper part of that, and then literally just squeeze in a couple of drops into the tray. And you want to make sure that that it fills the cup to the top, and then give it a moment to actually sink into the test. So to saturate the test properly. So you can put 1 or 2 drops in there to make sure it fills the test adequately. If it's too dry, it's not going to get an accurate result. And so you want to make sure that enough of the blood sample makes it into the testing mechanism.
Okay, so now that the blood sample is in the test itself, what is the next step? Do we add anything more to this test?
Yeah, there's 2 other bottles order.
So I see a color developer and a clarifying solution. With these instructions specifically, it looks like you do the developer and then the solution. They're numbered 1, 2, and 3 as well, so I suppose that's handy.
That is handy. And so you take the developer, the number 2, and you do the same thing. Repeat the exact same thing you did before, which is open it and drop and make sure it has a chance to fill the little cup there, and then drop down to its level and the test is saturated again. And then you repeat that with the 3rd vial.
So all 3 vials are now in the test. We're about to read a result. What is the individual expecting to see? What can they expect to see? What will the individual read on the test following the 3 vials?
Well, the hardest part of all is the waiting, because now you have to give it a few minutes for the test to become reactive, right? And so, again, you should look on the test you have to see what indicates a positive or negative result. That would be the clearest way to do that. There'll be a series of dots, right? And 1 dot means one thing, 2 dots mean another, a partially faded dot means one more thing, and so forth. So make sure you have the instructions handy so you can clearly see what indicates a positive test and what does it indicate for this particular test.
On this test specifically, it does have very clear visualizations of the test itself and the dots that may or may not appear based on what the result is. So we have a negative test showing only 1 control dot. A positive test will have 2 dots. 2 dots mean your test result is positive. You may be HIV positive. Positive results must be confirmed by a doctor. They also have a note that says that an invalid test will only have 1 dot on the test in a separate location than the negative test. So it seems to be quite clear according to these instructions. This leads into my next question for you. When an individual has whichever result that they come out with, what is the next step? If they see a positive test on the home test kit, it says must be confirmed by a doctor. So we'll start there. What would you advise that person does next?
The best thing to do is to contact your local AIDS service organization and reach out to them and see if they can refer you where you need to go. And they can also help you with counseling. In fact, even before you take the test, if you have questions or you have concerns about the risk behavior you were part of, you should reach out and speak to someone and ask for pre-test counseling and post-test counseling. Whether your result is positive or negative, you may want to speak to somebody about how you're feeling, right? Because just the whole notion of taking the test can cause some anxiety in some people. And so it's perfectly fine to ask for help and have someone be there with you on the phone while you take the test, even if you want. You're still anonymous. But in this instance, you have someone there to talk to you. So I'd recommend that people try that by going to an HIV clinic or to your GP and asking for confirmatory blood test. And they'll do a traditional blood draw and send your blood to be tested for HIV. And they'll do a viral load test as well. That'll indicate how much virus is in your system at the time of the test. Subsequently, it'll give you a clear indication of whether or not you have HIV for real and where in the process you are of infection. Because it's possible you were infected a few days ago, in which case live virus will be low, but if it's more than a couple of days, it could be very, very high. Right?
There's more information to be taken at that point. So a positive result, you can seek more clarification on the current state of your status. You can also seek out the adequate support for your own personal situation. Now that you're armed with this information, you can take whichever measures feel the most appropriate to you for your emotional state. And then you can also, on the physical side, start on the right foot to receive the treatment as well.
Well, exactly. And treatment is a discussion. It's not just that 100% I'm going to start treatment right away, though that is recommended. But it's possible that people may want to take time to consider, and if their viral load is low enough that they're not at risk to anybody else, and they acknowledge the fact that they need to either abstain from sex or practice safer sex. In the meantime, when they decide what they're going to do about treatment, then they can make that choice for themselves. Everyone has their own right to self-determination in this, accepting treatment of any kind. But I strongly recommend that you actually start antiretroviral therapy right away. I often mention to people that if you're diagnosed as a young person with HIV today, your life expectancy is actually now longer than the regular Canadian person, because people with HIV see their doctors at least annually, often twice a year. And when they see their doctor, they're tested for everything because of the nature of an anti-immune condition. They get tested for cancers and for kidney disease and liver failure and heart disease and yada, 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 which means anything that does crop up in your biochemistry is caught early and is treated early. Therefore, you have a healthier, longer life than most Canadians do. So I truly do recommend starting treatment as soon as you get the positive diagnosis.
It starts with arming yourself with the information, it seems like. Now, speaking of that type of context, an individual today may be listening or watching this podcast, learning about this test, and then find themselves in the future in need of a test. They've obtained one, and it is, as you've even said, an emotionally heightened situation. You mentioned that you can actually speak to someone at the same time as administering the test for yourself, and you remain anonymous. Could you speak a little bit more to the support available to someone who may want to take this test in the future? Is there a resource that they can look up to help guide them through the process?
Yeah, there are several. There's the REACH testing site, there's the Get a Kit testing site. Most ASOs will have a link to their testing programs. You can reach out to public health. They'll have a whole page on testing, which will include probably descriptions about home tests and so forth. So there's hundreds of places to go to find information on HIV testing and in particular self-testing. So just go into Google and type in HIV self-tests and put your local municipality in, and the answer will crop up very quickly. And then in terms of if you're a person who's engaging in high-risk behavior, for example, let's say you're a young gay man and you're engaged in regular sexual activities. You're a healthy young gay man and you want to see what's out there and you're having a good time. Well, if you're concerned about condom breakage and maybe being inebriated one night and perhaps not remembering whether or not you used a condom, then maybe it's time for you to consider PrEP, which is pre-exposure prophylaxis. So that's taking HIV medication in advance of high-risk behavior. So you go on HIV medication as a preventative treatment, and it's 99% effective in preventing new infections of HIV. So there's reasons to get tested and then to look at the negative result and also think, well, now do I need to think about PrEP? Just something I need to look at for the future. If you're someone who's not out there doing high-risk activity, not using injection drugs, not having multiple sexual partners, then your risk is relatively low. Well, then I'd say, test when you feel there's been an exposure. Test when you feel there's a need. But for those people who are considered high risk, which is people who are highly sexually active or their partners are sexually active or they use injection drugs or they're a member of a party population, then those people should get tested more often. We'll think about PrEP.
A negative result doesn't always mean no further awareness and precautionary action to be taken. It is just information that day for the individual who has taken the test. Thank you so much for that clarification.
I think it's really key. If someone's gone to the point of asking for a home test and taking it home and then getting that pair of scissors to open up that bag and actually, start the process, there's a reason why, right? If you must have felt inside that you needed to do take this test for whatever suspicion you had, whether it's for yourself or somebody else or whatever. And it's just another tool in your sexual health kit, right? Like condoms, like the pill, like all manner of things. IUDs. I mean, it's just another thing that contributes to a healthy, robust sex life.
That was an excellent way to sum that up. A tool in a kit, equipping yourself with the information is important, and making decisions accordingly based on what that tool provides for you. Adrian, thank you so much for joining us today. I really appreciate you taking the time out of your very busy schedule to help us with this, to go through this test, and to provide this excellent information and just provide your background to this. It has been really wonderful. It's been an honor to have you on today. Thank you so much for joining us. Is there anything else that you feel you would like a listener to take away from this episode, specifically about the test kit or just about HIV in general?
Yes. I want people to talk about testing. I want you, when you're out at social situations, at parties, at a bar, and you talk with your friends and say, hey, you ever thought about taking the HIV test and contest? Because it's the stigma that prevents people from testing, right? And so if you reduce the stigma and reduce the shame and make HIV testing as the regular part of your like you said, part of your regular sex health toolkit, it demystifies it. It makes it less scary. It makes it just something to do as part of your self-care routine. And so I really encourage people to be vocal about thinking of taking an HIV test to get them take it home now. Do you guys think of doing one? Have you ever done one? Be surprised. They will probably yes, I did one last year when I didn't this happened. So I would just suggest people, even though it's kind of taboo to talk about sex in some Canadian environments, go for it.
Thank you so much once again, Adrian, for joining us on Healthy Canadians Behind the Science today. I know I've learned a lot, and I agree with you. The more that we have this conversation, hopefully the more people it reaches. So thanks again.
Thank you. Pleasure to be here.
Thanks for tuning in to Healthy Canadians Behind the Science. If you're watching on YouTube, don't forget to click the like button below and subscribe to stay up to date on future episodes. Find us wherever you get your podcasts and leave us a review if you've liked what you've heard. For more information about the health topics that matter to you, visit canada.ca/health.